Hi, Rachel. I'm Karen. So I did watch your video, and you were talking about the first thing what would you prioritize um for that based on the video that we watched in Lippincott um about the expertise, clinician expertise, and the patient's preference. Um, yeah, I agree with you. Here's what I'm gonna do first. I would think about the safety of the patient first all the time. And then I would think about the dignity next, and then the autonomy, and then the beneficence. For the reason of safety always comes first. That's what it comes to my mind first. It's always the safety of the patient first. Of course, next is I would consider, the dignity. What would the patient's preference? So, and then I'm gonna listen to the family because after the patient, the family, I have to listen to them too. I have to. And then I would figure it out, you know, if the patient has actually have its own mind and still can make a decision making for himself. And then next, if I decided or I kind of found out that the patient is cannot decide for themselves, I have to talk to the family. So who's the guardian? So who's the signer of this patient? Who decides for medications and health for those things? There's the power of attorney and everything. So I have to talk to that person, a guardian, the power of attorney. I have to talk to them if the patient cannot decide. And then I have to decide again, beneficence. I always want to be for the best for the patient. Find out if the family is for the patient's also safety, thinking about the safety of that patient. I have to think of that. Are they abusing their family? I have to think of that so that I can report them. I mean, not that I really want to do that, but what if it's really the case? So I have to think the last one would be the beneficence because I have to listen to everybody before I can actually decide and what I have to document. Um, yeah, because we're kind of like, we have to. That's our job to report. Um, so that's my take for that. Thank you, Rachel.